So I'm a gastroenterology fellow. My research interest is inflammatory bowel disease outcomes. But the study I'll be presenting today is the one that was funded by GERF. So the aim of the study was to look at why patients with ulcerative colitis, whose bowels are healed, continue to have symptoms like urgency, frequency of stooling. Crohn's disease is well known to be a progressive disease. So over time, patients who are not treated properly will have irreversible damage. So up to about 70% of patients will ultimately need surgery. Ulcerative colitis, however, historically has not been thought to be progressive. But we think this notion is untrue. So we hypothesize that ulcerative colitis, over time, if it's not treated properly, patients develop fibrosis and scarring of the rectum. And that ultimately leads to loss of elasticity of the rectum, so it doesn't store stool properly. For the first time ever, we've used a highly accurate device, the barostat device, that measures the rectal compliance, or it's another word for elasticity. And we're able to study that in ulcerative colitis patients and then compare them to normal individuals, our control group. So far, we have been able to recruit 56 patients, and we have very interesting results, very promising. So you could see in the red line, these are the ulcerative colitis patients who have active disease, and their graph is much lower than the rest, showing that they have much reduced compliance or elasticity to the rectum, as we predicted. And the blue line, over time, once these patients are healed or are not inflamed anymore, their compliance improves, but it doesn't really restore to normal level of elasticity or compliance, as you can see when you compare them to the control, which are the green line. So this is very interesting. If we were to really prove our hypothesis, this would really change the way we understand ulcerative colitis, the history of the disease, the natural history of the disease, how it progresses, and how we should ultimately treat it. And our hope is that will also direct us of how to prevent irreversible damage and reserve these patients' quality of life. So with that, thank you so much for all the support to allow us to better the lives of IBD patients. Thank you.